Hello everyone, my name is Jacqueline Nazarin and the topic of research I chose to focus on is binge drinking among female college students in Los Angeles County. Alcohol is the second leading cause of premature death and disability in Los Angeles County and is associated with more than 54 acute and chronic health conditions. In Los Angeles County, the number of alcohol-related emergency department visits has increased 82% from 2006 to 2013. 1 in 3 young adults ages 18 to 25 binge drink. Binge drinking is a form of alcohol abuse and is defined differently for men and women due to the rate at which they metabolize alcohol. For men, consuming 5 or more drinks in one sitting is considered binge drinking, and for women, it's consuming 4 or more drinks within a 2-hour window. Overall, in the United States, 18 to 24-year-olds account for 25.1% of the population that binge drink. Healthy People 2020 has made binge drinking one of their objectives, and since the baseline of 26.9% was established in 2015, the rate has not significantly decreased. The rate in 2016 was 26.2%. This study is designed to identify the prevalence of binge drinking behavior among female college students ages 18 to 24. The study also is designed to understand the perceived beliefs and attitudes of female college students as it relates to excessive drinking behaviors. With the results of this study, we hope to assess the need for interventions targeted at the college student population to increase self-efficacy and reduce binge drinking behaviors as a result of the expected behaviors and subjective. Do female college students age 18 to 24 binge drink more than male college students ages 18 to 24? Do female college students perceive binge drinking as normal expected behavior? And are female college students more likely to binge drink based on perceived popularity of drinking alcohol? Did found a few consistent findings. The literature states that alcohol abuse continues to be a problem, especially within the 18 to 24-year-old population. The literature found that typically men tend to binge drink more than the women surveyed. However, majority of the data is self-reported in regards to the frequency of binge drinking behavior. Women tend to report a less number than the men do. Additionally, researchers found that popularity and perception of alcohol consumption determines whether one engages in the behavior or not. The literature review also found that most strategies that currently exist are targeted towards alcohol retailers, marketing strategies, and laws that regulate sales to minors. There are school-based intervention programs that have been implemented to focus on preventing the alcohol and drug use among adolescents. The school-based curriculums are aimed at improving decision-making and increasing their self-efficacy of students when faced with the decision to say no. Some examples of such programs are Project Northland, Project Towards No Drugs, and Project STAR. Curriculums for college students. The literature review also found that most strategies are targeted towards alcohol retailers, marketing strategies, and laws that regulate sales to minors. School-based intervention programs are implemented and they're focused more on preventing alcohol and other drug use among the adolescent population. These school-based curriculums are aimed at improving decision-making and increasing the self-efficacy of students when faced with the decision to say no. Some examples are Project Northland, Project Towards No Drugs, Project STAR, and the curriculum BotFin Life Skills. There are curriculums for college students. Although they are limited, they are available online and often are mandatory trainings before enrollment, similar to CSUN's requirement. However, it has been found that to be effective, universities need to engage students more and put other processes in place to reduce alcohol abuse among their college students. Outside of mandatory online trainings, it's recommended to schedule class on Fridays to reduce partying on Thursday. They should monitor sororities and fraternities to reduce house parties that have excessive alcohol consumption, additionally restricting alcohol promotions on campus and sponsors of athletic teams. Various research studies and interventions have been conducted in regards to binge drinking and the related social norms and experiences. These research studies use the theory of planned behavior as the basis of their intervention. It has been found that the social norm interventions are based on individual perceptions and beliefs about what constitutes a normal drinking behavior. One example states that if an individual believes that his or her peers drink heavily, this influences the amount of alcohol that the individual drinks. However, it's shown that oftentimes peers overestimate the amount of alcohol their peers are drinking. Utilizing the theory of planned behavior, researchers have been able to better understand the relationship between social norms, attitudes, and the amount of alcohol consumption among college students. This research study focuses on the target population of males and female college students ages 18 to 24 living in Los Angeles County. This research will be conducted at 5 college campuses across LA County. The study will utilize a mixed method congruent triangulation approach, which will include a focus group interviews and electronic surveys for data collection. The focus group will be used to collect qualitative data. They will be conducted at 5 identified campuses. The researchers will conduct interviews of 20 female students each for a total of 100 students. The focus groups will be used to understand the perceptions, norms, and expected behaviors at these campuses. The electronic surveys will be conducted at all 5 campuses as well for all students ages 18 to 24. Due to the age group and their level of tech literacy, electronic surveys are a more cost-effective option. This survey will collect both qualitative and quantitative data. In order to conduct the survey electronically, approval will be required from the school. It will require partnering with the campus health center to distribute the surveys to their students. Once the data is collected, analysis of the data will include confirming and validating a focus group qualitative data with the electronic survey data. Additionally, quantitative data will be analyzed using SPSS to calculate the descriptive statistics, which will provide a better understanding in the amount and frequency of the drinking behavior. This research study will utilize both the theory of planned behavior and the social cognitive theory. Questions will be focused on subjective norms and attitudes using constructs from the theory of planned behavior. Additionally, the research will also be based around the environmental factors and expectancy constructs from the social cognitive theory. The top diagram depicts the theory of planned behavior as it relates to alcohol consumption. The attitude towards the behavior, such as binge drinking is dangerous, influences the subjective norm that everybody's doing it, which is also influencing the perceived behavioral control, such as I have to go along with it if I want to be liked. All of these will influence the intention and ultimately the behavior itself. With this research, there are some limitations. In regards to the focus group, it is time consuming for the researcher to conduct these interviews across 5 campuses. Additionally, participants may not answer honestly when in a group of individuals they are not familiar with or even with the interviewer. In regards to the survey, the absence of the interviewer increases the likelihood of participants skipping questions. Additionally, dishonesty is always a concern, and especially when the topic is sensitive, the concern is greater. Analysis of the interviews may also be a limitation, as they might be biased based on the researcher's perceptions, which also influences the interpretation and understanding of responses the participants provide. Lastly, when looking at cost efficiency, the electronic surveys are more cost effective and less time consuming, but the focus groups are quite the opposite and require the researcher to dedicate face to face time with the participants. In conclusion, by conducting this study within this population, we aim to better understand the perceptions of female college students and implement strategies to decrease the prevalence of binge drinking among this population. In doing so, we aim to decrease the overall binge drinking rate within Los Angeles County. This is a list of the references used. Thank you for your time.